Good afternoon and welcome to Webinar Wednesday. Today we are joined by Kapil Asher, Global Head of Healthcare Practice at Contact.io, and Matt Canal, Senior Director Professional Services at Contact.io. Webinar Wednesday would like to thank our sponsor, Contact.io. Contact.io offers a long-awaited breakthrough in indoor location services, which traditionally have been expensive, difficult to deploy and maintain. Their open source, easy to install Wi-Fi network agnostic, cloud-managed, completely wireless devices provide 100% room-level location accuracy of medical devices, staff and patients. Their solution enables asset management use cases such as device search for preventative maintenance, power level management and loss prevention, and can scale into other offerings such as staff duress and patient elopement. For more information, please visit contact.io. And just a quick reminder about our Fall MD Expo. We're headed to the Caribe Royal Hotel in Orlando, Florida from October the 29th to the 31st. Join us for 3 days of education, networking, and the latest advances in medical technology products and services. Registration is now open, so for more details, please visit mdexposhow.com. Also, there's a copy of the pre-show planner, and that can be found in the handout section of your webinar dashboard. I'd like just to add that in its continued effort to promote and applaud men and women in the HTM industry, TechNation magazine is introducing the Tech Choice Awards, also known as the Wrenches. Nominations are being accepted in a variety of categories through to November the 3rd. So up to 13 wrenches will be awarded, with the winners selected based on 100% on votes from those who can make up the HTM industry. The winners will be announced in the March 2024 issue of TechNation. And more details can also be found in the handout section of your dashboard and also online at technation.com/tech-choice-awards. Okay, today's webinar is eligible for 1 CE credit from the ACI, and you can obtain your CE certificate by completing the post-webinar survey, which will be emailed 1 hour after the completion of today's webinar. You must complete the survey to receive your 1 CE credit, and you'll be able to download the certificate directly from your computer once the survey is submitted. If you have any questions, you can reach us at webinar@mdpublishing.com. Let's kick off today's webinar by giving away one of our great Webinar Wednesday t-shirts to the attendee that can tell me the answer to the following trivia question. Today is National Peanut Day. Which state is the largest producer of peanuts? Answer now using the questions feature on your dashboard, and I'll reveal the answer at the end of the webinar. We'll wrap up today's presentation with a live Q&A, so please submit your questions anytime using the questions feature on the dashboard. As I mentioned earlier, our presenters today are Kapil Asher and Matt Canal, and they will be discussing the Contact.io Playbook, expert insights on successful RTLS deployments in hospitals. Kapil, you may begin whenever you're ready.
Thank you, Linda. I hope you can hear me. Can you do a quick sound check?
Yep, I can hear you.
Awesome. Thank you so much, and good morning and good afternoon, everyone from the audience. I'm talking to you from a very, very rainy Boston, Massachusetts, and I couldn't be more excited to present what we've got for you today. The topic, like Linda said, is about Contact.io Playbook, and I've invited my most favorite colleague from Contact.io, Matt Canal, who heads the professional services team, to help us, navigate through a complex topic such as this one today. Before we get into the nitty-gritty of those, the playbook itself, I wanted to just give a quick recap on what Contact.io is all about, so that audience who've never heard of us before can, get a little bit of insight into what we do and what is our mission and why are we in the business of RTLS right now. Once we get through that, I will start, having a discussion with Matt, and we'll go through some of the nitty-gritties of how deployments happen. So let's start with who we are, what's our mission. We save hospitals millions by optimizing their efficiency and improving the quality of care. We do this by using cloud, AI, Internet of Things sensors, to quantify and understand the interactions and whereabouts of things, people, patients, all these necessary resources to provide excellent quality care within our hospitals. At the end of the day, we are helping our hospital leaders to improve their operating margins so they can focus some of that back to quality patient care. We are the fastest growing solution provider in this industry, in this particular industry. You can see some of our flags that are on multiple states within the US, and they've rapidly grown into adopting our technology in the past, I would say 3 or 4 years now. Why us, right? Why do hospitals switch over from their existing legacy RTLS providers to us? So I'll just give you a quick recap of our value proposition. First is we are the most comprehensive healthcare IoT stack out in the market. All of our location sensors, our IoT sensors, they communicate over Bluetooth Low Energy, BLE, and we are able to leverage, in the most part, existing infrastructure that our health systems may have. May it come from wireless access points or even lighting. Certain new lightings have a BLE module in them. So in the most part, we can leverage what they have to make a very rapid deployment possible. But in cases where that's not possible, we come up with our entire turnkey solution with a very low touch point in deployment. And all that data goes straight out to the cloud. So our comprehensive IoT stack makes it very simple for someone to switch over from their legacy infrastructure to modernizing their infrastructure to provide location services everywhere. The second thing is we are one of the quickest time to value in the industry. This is a real world example. We are helping a 582 bed hospital with their pump utilization. System roughly had about 1,800, 1,740 to be precise. And their average utilization was low in the 40% range. I'm actually certain it was lower than 40%. And after deploying the Contact IO solution with our RTLS and our workflows, we were able to improve that utilization significantly by 20% and had some idle quantities for them, which they were able to sell in a used market. And they were also able to improve their productivity. And all of this gave them a 4.3x ROI within the first 6 to 8 months of deployment. So, Matt will talk about how this is possible and how we can provide such quick return on investment. But I just wanted to give you a snapshot of how this happens. Finally, we are not one-trick pony. I love to use that term. We don't pigeonhole you into one system that cannot be expanded into other use cases. When you talk about modernizing a hospital to make it truly smart, you don't touch just one use case. You want to invest in something that has multiple uses for that, right? So yes, we provide efficiency with medical device management, but we can also provide things like staff safety that helps with the well-being of the staff members. And we can help with improving patient workflows so that you can see more patients in a small amount of time to improve your revenue, right? So as you go up the chain over here, you have some overlapping use cases that touch staff as well as patients. And eventual goal is to, again, improve operating margins for that hospital. So here, I hope that quick recap gave you a background on what Contact IO does. And I'm going to stop sharing so I can see Matt on video. And we can continue with our discussion. Hey, Matt, how are you feeling? You good?
I'm doing great, Kapil. Good afternoon. How are you?
Good. I'm great. I'm great. So, so you head the professional services at Contact IO. Can you give us a little background on yourself and maybe even talk about your team? Can we introduce your team to the world and show them what we've got?
Yeah, I'd love to. I'll start with the team and I'll finish with me because the team's most important. So we have a team of service experts. Many have been in the industry a long, long time for well-known RTLS providers. In service, what do we do? Everything post-sale. So a sale is made, services takes over. We come in with a delivery function, think project management. So we project manage an implementation. We can either bring in people to do the implementation or train people that are already in the facility to do the implementation. I kind of like that, and I'm sure we'll talk about that more in the webinar today. But then post go live, we hand off to customer success and technical support. So that's all part of service, and I know we'll talk about customer success later. Me personally, I'm talking to you from Richmond, Virginia, a beautiful part of the United States. I've lived here about 20 years, and I actually did my first full hospital implementation with RTLS in 2003. So that dates me a little bit, but I've been lucky enough to do hundreds and hundreds and touch thousands and millions of assets. And I've been in healthcare for about 20 years.
That's awesome. I like to start with this question, Matt, because yeah, technology is one thing, but the team is the most important, right? People who have the experience of doing this year over year in multiple different hospitals, because they are all nuanced, they are all different. So I just wanted to let the audience know that you're in great hands when Matt and his team comes in. So that's a great start to our discussion today. So let's start with amount of prep work necessary to get a hospital ready for RTLS deployment. So I know the audience here we're talking to are from HTM, biomed clinical engineering. You know, there are multiple different titles who obviously need to be involved as a stakeholder. But what is required from IT? Who are the folks that typically are needed from the IT side of things? What about clinical staff? Are nurses involved, and if so, in what capacity? Can you just give us some background on that?
Yeah, absolutely. I'll start. I'll start by saying, and I'm sure I'm going to touch on this quite a lot throughout today. Communication's key. Proper communication at the beginning, throughout a project, throughout an implementation, is the way to be successful. Having a proper communication plan that not only puts meetings on the calendars, because nobody needs more meetings, but having a plan that says these people are going to meet at these frequencies to talk about these things, getting the right people in the right place at the right time, not to waste anybody's time is critical. So facilities, we're coming into your facility. Either I'm helping you implement in your own facility, or we're bringing people into your facility. Facilities are critical because, again, you're going in their facility, but they also know and are acutely aware of what's going on in the facility right now that might be problematic. Maybe there's some construction or something. Furthermore, medium term, what other construction may be taking place? So getting with facilities and understanding those things is really, really important. Secondly, you mentioned HTM. This is an HTM focus group, I'm sure. Gosh, if we were implementing an asset management program, one of our basic use cases, we're really going to help you guys. So getting involved with us and us getting involved with you early is really important. Think about your pump month. You know, you can start finding pumps really easy without any system, but getting towards the end of that month, that cycle to be compliant is just critical. So having an RTLS friend and a system that can help you find and pick those items you're still looking for to make your metrics is really, really important. IT. We are a very low touch on IT. And what we like to do is get it upfront. One of the first conversations we like to have is we're going to bring in some IoT devices, true IoT devices. They're going to connect to your pre-existing wireless network, an investment that you've made. We're going to use that, and we're going to communicate to the cloud. So we need to make sure that that can work and operate. But what's the beautiful thing is that's really it. Once we get actually into the implementation, we've already proven with IT that it works. We understand IT is super busy all the time, but there's no on-demand, I need this from IT, I need that. We keep you aware through communication that I stated at the beginning, and we get up front with IT, get it into their schedule, and then we're a very low touch point on IT. Finally, clinicians. In an asset management scenario, we are really trying to help clinicians fundamentally so they can spend less time searching for stuff and more time giving care with patients, right? right? So one of the things that we like to say, and we have some really good communication tools, video and things like that, is when you see the team that's implementing moving around the hospital, if you're aware of a closet or a cabinet or somewhere where maybe something's stashed, let us know where it is. Let us tag it, because now using a digital front door, you can actually find those things without having to hide things, just so you've always got them. So we want to be clinician's best friend. We're here to help, and we're here to give you some time back and reduce stress of looking for things.
That's awesome. I just want to probe on a couple of things that you just said. So obviously we are helping biomed, and you bring up pump month, which is pretty critical. I think the big thing is to get into an RTLS system at a time when pump month is just a few months away, so that the touch point of using the pumps going through a choke point of maintenance, you can also tag them at the same time.
Yeah.
So it reduces the time to tag things in a significant manner, and then you're ready for the next event that happens a year down the line, right? That was
Yeah.
one thing I wanted to bring up. And then the second thing is IT. So every time we speak with Biomed, I think the first concern they have is like, how heavy is this going to be on my IT team? They're stretched so thin, and usually they're very busy, and I don't get on their calendars for 6 months from now. So I think you bring up a great point that there's such a low touch from an IT standpoint that you just have to tell them, you know what, it's all simple. I'm just going to tell you, get on a call, spend 30 minutes with Matt. He'll explain how this whole thing works, and you'll see it's not going to be a big bother for you.
That's right. That's right.
And then we can even arm IT and say that, hey, you just made an investment in your new wireless system. This company can leverage that, so help you spread use cases over what you purchased that infrastructure for already. So amazing points over there, and I hope our audience takes notes out of that. Uh, let's talk about some of the things that we recommend our customers watch out for. Things that could delay a deployment process. What are some of the things they should be wary of and take care of before we get in?
Yeah, I think the one that springs to mind, I mentioned it when I mentioned facilities in the previous question, just understanding and getting ahead of change. Things that we know a schedule that's going to happen, big change projects, everyone's aware of them, right? So let's talk about that and decide, should we leave this unit alone during the implementation? Should we implement it knowing that it's temporary, or should we just leave it alone and circle back around? So change, we know it's ongoing, it happens daily in hospitals. But with all that said, we've designed what I like to call a frictionless installation process. And we have mobile tools that support that, so that anybody that's willing to learn and use our tools actually has the ability to move, add, change a deployment post go live. These tools run on a mobile phone. So think like a standard iOS or Android app, right? And it makes it really super intuitive and easy, like any good app, so that you can actually change things over time. So traditionally, a change has become another project, right? We have to maybe bring in another crew, maybe pull some cables, or do something because it's all proprietary. Our tools are not. They're intended to be left behind. And we provide training during the project and at the end, so that people can use those tools to move and change things over time themselves, making it somewhat frictionless, as I stated.
That's great. So speaking of, right, so we want to make sure that things happen in a certain ways to avoid delays. Let's tell the audience about physical requirements, right? What do we need in the ceilings or in the walls before we start putting our gear in there?
Yeah. The great news is the absolutely nothing. Um, it's the beauty of the Contact.io infrastructure and our IoT devices. We've designed an infrastructure that doesn't require cable. And when you don't have cabling, you don't go in ceilings. You don't need HEPA tents and things like that. We don't need to involve infection control and things like that. Our devices are wireless and battery operated. So we're not looking for, again, cabling to power things, Ethernet cables and things like that. But I think that makes it super, super easy. Our Bluetooth gateways, we call them a Portal Lite. They plug into a pre-existing outlet. So that's how they get power. And they communicate over the Wi-Fi, an existing Wi-Fi, as I stated up front, out and directly to the cloud from that initial engagement that we have with IT way up front before any of the work actually starts. When the work starts, everything just works.
Mhm. So this is a good point, right? So you sound like your oversimplification is, maybe kind of an illusion and it's not true. But it actually is, and we were joking about this a couple of days ago, right? Like, what if the
Yeah.
audience thinks that this is too simple? It can't be that simple. But it truly is. I know of, from the pre-sale side of things, at least, when we send demo units to our customers, we tell them, you know what, just give us a call when the things get delivered, and we'll talk about it. We'll walk you through all of that. And 90% of the times, I get a call from them after they've set up everything, after they've, created the cloud instance, they've set up everything, they've started testing, the accuracy and all those things. And then they just give me a call to say, okay, everything is set up. How do I make this user friendly, or, actually sell it to my users at that point, not really user friendly. So it's kind of surprising to me sometimes, even after I've been here for 3 years, that people call me after the fact that they've done all the setup work on their own without even calling us for that part. And we are, and what I like to say is we are designing an enterprise system, keeping consumer grade operation in mind, right? So it's as easy as setting up a Ring doorbell, and I know you had that example when we were talking about it. But can you just elaborate on that analogy of how we can set up? Yeah.
Yeah, I think what you're ultimately getting toward is a mission. A mission is
Mhm.
to be extremely scalable at
Mhm.
speed without losing any quality, right? That's
Mhm.
critical to success. So thinking about consumer grade products, right? You get them, there's a barcode, you scan it, you plug it in, it connects to your Wi-Fi, and it just works.
Yeah.
That's exactly what we do. So when we arrive from an implementation perspective, we want to be as least invasive as possible, especially in a patient room, right? People are not necessarily in hospitals because they want to be there, right? But we would like to be in there and be as minimally invasive as possible. So the way our hardware arrives at site is already ready to work. No testing, no tuning. You plug it
Mhm.
in, you switch it on, and it works because we've done the pre-work with IT way up front. We're estimating, to go into a room, we're in seconds to
Mhm.
implement a room to get an accuracy that's acceptable.
So that's a great segue to my next question, right? So, what would you say, let's say an average 300 bed hospital, what would it take to implement, like from a
Yeah,
time standpoint? And maybe you can elaborate on the design principles that make this deployment so quick. And I know you've hit upon some of those already, but I'm even talking from server needs and those kinds of things. And then
yeah,
what type of validation happens? Can you elaborate a little bit on that as well?
yeah, yeah. So I think you asked me three things all in one there, Kapil. So first and foremost, the 300 bed hospital, right?
Mhm.
We can implement a 300 bed hospital in a couple of weeks. We can go faster than that. However, hospitals are already busy. There's already a bunch of things going on. So kind of my belief is not to try and go too quick, but make it fast, right?
Mhm.
But limit the amount of people that are going into the already busy facility. I think people respect that. I think people like that. So instead of an army of people just so we can go fast, I think if you're doing a couple of week installation on a 300 bed hospital, I think that's fast but still non-invasive. You just mentioned servers. We're IoT devices. We go direct to the cloud. So this is another good thing from an IT perspective. There are no servers, no physical servers, no VM servers acting as gateway proxies out to the cloud. We just don't need them. Therefore, IT do not need to build them, support them, maintain them, cool, power them, etc. There absolutely are none. From a design perspective, when we arrive, when the implementation team arrives to actually plug things in and tag things, the design is already done, and it's all done in what we call the Kia Contact.io cloud. So there's a whole process of map ingestion, polygon creation, device and labeling, and all of that good stuff. And that then drives our mobile tools, which integrate directly with our cloud too, and then drive that implementation.
Mhm.
I brought in the mobile tools here because now we're moving to point 3, which is validation.
Validation, yeah.
What often and traditionally happens is there's an install, it takes a long time, and then there's a bunch of testing and tuning, it takes a long time, and a bunch of validation. What we're trying to do, again, going back to the non-invasive comment I made previously, is we're trying to validate on the fly. We're not just trying, we're actually doing it. So our frictionless install tools have some really neat features, such as, okay, so you're going to tag this asset. I'm going to make sure that asset's working, it's switched on, it's in the cloud. I'm going to make sure that if hospitals allow us to, you can take a picture of that, so we can actually have some reference points of what we tagged. Plug in a portal light in a room, we can do the same thing, and we can validate that it's actually in the right room, and maybe also seeing its neighbors that it should be able to hear. BLE talks to BLE, and we don't want one thing putting in the wrong place. So we can get those things in real time. So technically what we're doing, and we're generating a big report that we print out at the end, is we're validating throughout the installation period, which also is a way that we can scale and go at the speed that we're talking about.
Yeah, you're kind of reminding me of my younger field engineering days, where I would carry a clunky IBM laptop on a cart with a spreadsheet, and I would be tired because it's like at the end of 8 hours, and I'm manually entering these barcodes in there, and obviously making mistakes. So I think this automation in validation just speeds up the process tremendously, right?
Yeah,
Um,
you have to enable and trust the guys and girls that are implementing with real-time tools that are actually implementing in real time. So there's not that rework, which creates additional rework and problems.
Yeah, correct. That's what I was getting at. Like you have field engineers who would go in, install, not knowing if what they've done is correct or not. And then there is another team who goes back 2 weeks
Yeah,
later and then they find so many different holes and need to plug in that holes, no pun intended. But in this case, when they leave the hospital after 2 weeks, they're confident that this is working and we could essentially go live the weekend after, right? So
yeah.
it's just amazing, and I hope the audience appreciate how amazing that is.
And it's more than just hearsay and us saying that it worked. We have the data, we have the ground truth, we have the capabilities to, print out a report that actually explains what we did as well, which I think is so powerful.
Mhm. And you have a sign off from the project manager from that side as
Yeah.
well. That's amazing. Uh, cool. So, Matt, you have recently led a huge deployment for an IDN with more than 40 hospitals. Can you share some lessons learned from that massive project? What should our audience take away from your experience and best practices?
Yeah, I actually started with this first comment, communication, communication, communication. Having a good, proper plan to communicate with the right people at the right time, at the right cadence is really important. What I also think is, and this is kind of in our DNA here at Contact.io, is that we will continually review what we are doing. Technology is evolving rapidly. Processes need to evolve at the same speed. So we continuously debrief and question every single thing that we have done and create these really unique feedback loops into our excellent product management team and engineering teams here at Contact, so that we can change our products as needed. And it's not just like my team, right? We have tons of vendors that we use as well. We continuously ask those guys, it's voice of customer ultimately from a product management perspective, but we're continuously asking questions. How can we do this better and better and better? So one of the biggest lessons learned that I've had in the past 15 months here at Contact is to continuously ask questions, to communicate really, really well, and then do something with that information. Feed it back to product. Sometimes it's not going to be a great idea. Sometimes it's going to be excellent, and we're just going to get better. My goal is to scale, be more efficient, and get better every single day.
Yeah, and that again goes back to my comment about how important the team is, right? Technology can only go a certain way, but the team is also as important as that. Um, so going back to this recent deployment that you did, right? So let's talk about our integration principles. So you and the audience know that rarely health systems run in silos, right? There's always this need for extracting data from one system to feed another system so you can enrich the data in that system. To simplify it, CMMS is a prime example of what HTM uses in general for their database for assets. How seamless is it to integrate with various CMMS leaders out there?
Yeah. So while services isn't necessarily supposed to be super, super technical, we feel so empowered at Contact.io because of the rich API background that we have. So anybody that's listening that's interested from a technical perspective just can go right now to developer.contact.io, and you can see a whole host of readily available APIs, either RESTful, Firehose APIs, you have it, push-pull, that are available right now. So you mentioned, Kapil, that sometimes you get surprised when people call you and they've just implemented everything without even telling you they was going to do that. I get the same surprises on the tech side where people say, "Oh yeah, I'm calling a device management API and I'm pulling down all the devices into my inventory so I can create ServiceNow CIs." Right? It's quite unique. It's all publicly available. I think I said at the beginning, good documentation,
So
good
there's no
online content.
firewall.
No,
You can go onto that website without any firewall, correct? For the support? Yeah. Okay.
yeah, that's right. That's right.
Yeah.
So all that data is available through your contact.io account. And again, we usually just point people at documentation versus have to handhold through an integration, which I've been doing integrations for 20 years, and I know how painful and expensive they are.
Yes.
Well, these ones are sat there ready and available. Again, shout out developer.contact.io.
Yeah, the sad part is because the previous generation integrations are so expensive, people generally leave out rich data that can be used for enhancing other systems, right? And it's just sad because there's data just screaming at you to be used, but you're not able to use it because there's some constraint on how you can pull it into your system.
Yep.
So I think we are almost at our 30-minute mark, and I think we just have two more topics to go over before we open it to Q&A. Let's talk about post go live. So implementation is done, validation is done. Go live, users are using the system. What is our kind of short-term plan on how do we stay back and help?
Yeah, I actually have a long-term plan. So, everybody has their own kind of version of what customer success is. And I'll tell you our vision, my vision, the vision for my customer success engineers. First and foremost, we introduce customer success at the beginning of a project. They need to be involved, they need to be engaged, because when the delivery team go live, get sign off, it's all beautiful. We leave customer success behind. They have, during the project, cultivated important relationships with key stakeholders, and they've figured out a cadence where we are going to continue to communicate with you. This isn't just about tech support or system maintenance. That's a piece of it, right? But for me, it's more about driving value and outcomes. So our customer success engineers are 100% engaged in the project. They know exactly what's going on, and then they continue the relationship for as long as the contract exists post go live. And what the beautiful thing about that is we not only continue to provide you somebody to speak to, somebody to ask questions to, but I mentioned technology evolves quickly. Contact.io evolves quickly too, because it has to, it should. The customer success engineers are linked into our product team, so they can be talking about what's coming, what just occurred, new features, new functions. And if there are other use case conversations sparked, then we can bring in the relevant commercial leaders to continue that conversation. So it's more of a long-term plan than a 30, 60, 90, I would say. And I think it's somewhat unique from an industry perspective of kind of how we handle that, just given that we understand how technology evolves.
Right, and I would also like to say that when the customer success gets involved, of course, they are making sure that the health of the system is up and running, nothing is, broken and all those things. And they proactively tell the system what needs to be addressing. But at the same time, they're helping our HTM customers with their KPIs, yeah, whatever performance index they had kind of set a goal for themselves. Our customer success helps them to achieve that goal as well. Simple example, IV pump utilization, right? So we start with the baseline data, we realize it's 30, 40% utilization, and then someone like Psyche South will go in and explain how you can improve that utilization, set up some power levels. If the power levels are too high, reduce them and free up some of that equipment that doesn't need to be sitting in a closet. And I think that is also a very unique aspect of what we do. Plus, we have all the rich data that you can use for BI, for business intelligence, that it's not just a hearsay. You can actually back on data when you're making some informed decisions and evidence-based decisions. So that, would you agree with that?
I do. I've said it once. I'll say it again. Customer success engineering isn't just about support and maintenance. Or one of my favorite phrases in this industry is the death of RTLS, which is where a project goes live and everybody disappears. And after a few months, the maintenance has just gotten on top of the whole system because nobody's done anything. Every RTLS system needs some type of maintenance. It's just inevitable. But that's not customer success. It's a part of it. What's more important is understanding that if you can keep the system nice and clean and healthy with process, then you can achieve the values and the outcomes that we set out to achieve at the beginning of the project. You can't do it without those two things don't work independently of each other. And what I find, and I've had lots of experience finding, is that when you do this frequently, just keep on top of everything, then the value remains. And to your point about the baseline, right? We're meeting frequently and we're looking at data frequently, evaluating against that baseline, and actually are being able to use the data to prove what we said right at the beginning as our goals and objectives for the project.
Awesome. This has been an amazing conversation, Matt. I think we should be able to open it up to questions. So Linda, can I hand over the mic back to you?
Yep, we've got a few come in. The first one is, my hospital has 332 beds. If I wanted the most basic form of asset tracking, how long would the deployment take?
Yeah,
so Matt, you want to take that one?
Yeah, I'll just dive straight in. Thanks for the question. It's always great when we get questions. So the most basic asset tracking solution would be a sprinkling of our portal lights across the facility, and obviously you've got to tag assets, right? So I would estimate that you could be up and running, in a week's time frame, quite frankly. And the beauty as well is because of this, that kind of IoT devices, once you've put tags on a particular floor and you've put particular devices on a floor, you can actually start seeing them in real time. So you don't actually have to complete. We want to complete, of course, but you could do it and then just see the value very, very quickly within, as soon as you start installing. But great question.
Okay, next question then is, we have tried RTLS in the past, but a year after we did our go live, the team abandoned the system partly because of battery maintenance. Do you provide any service to avoid this situation?
So yeah, let me take that one, and then Matt, I'm curious to hear your insights as well. So everything we do is as a service. So we are not in the business of selling widgets. Everything is an outcome that we sell. In this case, in this particular case, asset tracking at a pre-agreed upon level of accuracy is our responsibility. And then no matter what widgets or what devices are needed to achieve that outcome is part of that implementation. It's not nickel and diming more hardware, more money to be made. It's not like that. Everything is as a service and outcome, and the hardware just becomes part of that. Our batteries are long lasting anyways, and Matt can give you some numbers around that. But it's our responsibility. So we monitor them remotely. We make sure that they are in proper operating condition. If they are not, then proactively, as long as you are under contract with us, we'll send you new batteries, new tags to kind of replenish the old ones, right? So even before your team notices it, you will have a new fleet of things in there to make sure that you are never running out of battery. Matt, any comment from your side?
Yeah, I think I know where this question is coming from. I've spoke to many people where there's this kind of battery life confusion where batteries can last 6 months, 2 years, whatever, and it's all very, very different. And very typically those sites are what I class as that kind of death of RTLS, I would say. So two things. One, our batteries last a really long time, minimum 3-4 years minimum, right? But then also what's really important is what I was talking about with customer success, right? We are continuously working with you and monitoring some of those things and being innovative about, at the right time when we might want to swap. We might say, well, look, we're getting up to the, XN year mark on your IV pumps. And in May, you're doing a refresh. So maybe that's the time to swap. So just like kind of looking forward, not backwards on the problem. It's kind of our strategy and planning that with you over time.
Okay, that's great. Another one, I think is more of a recap question. We are in the process of searching for an RTLS solution. What are some of the things we should be asking potential vendors?
So yeah, I think that's pretty much like Linda, you said, it's a summary of everything that we spoke today, right? I think I'll be very honest. I think the team matters. Who you're working with matters a lot. You met Matt today. His team is awesome. They've been experts in this industry for several years. So I think judge on the team as well, not just the technology. But when you speak, just on the technology front itself, make sure it's a scalable infrastructure. Make sure it's not just meant to do one thing, because you spend too much money into achieving one use case, and you would have a parallel, system doing another use case, but both could have been achieved from one platform, right? And that's what we are all about. We will come in with one use case, whether it's asset tracking, whether it's staff duress, but then we show you the promised land, how you can spread that ROI across multiple departments. Make sure that things are open, obviously secured, but open for data sharing, and they're not siloed or monopolistic in one way that you just cannot extract that data to enrich it in some other system out there. Matt, do you have any comments on that, please?
No, I think you're right. That question really summarized the webinar.
Yeah.
What we're trying to do is non-invasive. It's quick. It leaves behind the ability for you to do things yourself as well, with that ongoing support from a success perspective. And Kapil used the phrase at the beginning of the webinar, one trick pony, that we're certainly not. And that's key, right? We're leveraging pre-existing investments like your wireless network, and able to add on use cases as you wish.
Okay, perfect. I've actually got a couple of more questions. I'm going to have a few attendees asking how they can get in contact with you. Could you put your contact details up on the screen? I've got people asking where they can get demos of software, etc.
So I don't have a screen to put that up right here, but we can certainly reach out to all the attendees with the pertinent information that they can call into. So I'm Kapil Asher. I am the practice leader for healthcare, k.asher@contact.io. There is not a single C in that entire email. It's all Ks. So that is one way to reach me. But I'm sure as we get the list of attendees from our TechNation, we'll reach out and provide more information. And even the presentation we did today, that can be made available as well.
Okay, that's great. Not sure if you're aware, but we do get attendees attending the webinars from internationally. And I have got a question here. What technology does RTLS use?
So RTLS is called, real-time location sensing. So there are multiple ways you can achieve location sensing. Our particular technology is based on Bluetooth and infrared. So Bluetooth low energy, they are radio frequency signals that our location sensors are emitting. And then depending on our infrastructure, those are getting scanned, and then a location estimate is provided within our location engine. It's our own secret sauce. We take raw data from multiple location sensors and apply the logic to make the best guess location possible out of there. And then the infrared on top of that can help you achieve 100% room level accuracy. So that's how RTLS works in our particular case.
Perfect. Right, this one is going back to the beginning of your presentation. In your opening comments, you mentioned a 4 times ROI in 6 to 8 months that covered multiple areas: capital, rental, set loss, productivity, etc. Can you elaborate on how you are able to gather benchmark data, implement processes, and recognize an ROI, in such a short period of time?
Yeah, that's a great question, and I'm happy to do a deep dive on this as well. If the person who asked this question, send me an email, or even we can send that email. But essentially, it's all about utilization improvements, right? So high volume equipment like infusion pumps, everyone knows there's a shadow inventory just to make sure that there is one IV pump available when it's needed for patient care. And in reality, those many IV pumps are not needed. A standard benchmark that I've come across many times is 1.5 to 1.7x the number of licensed beds is how many IV pumps you would need. But you would still walk into a hospital and have 2-3x the number of licensed beds. So what we would do is we would come in, we would make sure that those all are trackable, and then we put some workflows on top of that, like power level management, making sure there is not too much dwell time on IV pumps, whether they are in soil situation or a clean situation. They need to be in rotation at all times. They should be either utilized on a patient, or they should be sitting in a central supply somewhere waiting to be deployed on a patient. And in that central supply, when you figure out there are too many you don't need, that's where you can make some money back. You can either workload balance those IV pumps to sister hospitals in your network who are actually struggling to keep up with the demand, or you can even sell them in a used market and make some money out of that. So that is how the quickest way is to get return on investment. But when you think about long-term improvements in productivity, improvements in not having to chase manually for your PMs, all of those things will add up, and you can free up some time for your biomed so they can go and learn more skills. You can avoid outsourcing certain repairs, which you've been spending a lot of money on. You can cut down on rentals now that you have a good handle on all your high volume equipment. you don't need as many rentals as you used to before. That is something you can stop on day one and avoid that cost. So all of these will lead up to an ROI that I mentioned up ahead in the presentation. But again, I'm happy to walk you through it with more details. We have models which we can show so that you get some evidence behind that ROI model as well.
Perfect. Just before we wrap up, is there anything you want to expand on or summarize?
So I think we covered everything. Once again, my name is Kapil Asher. I lead the practice for healthcare at Contact.io. You can use me as a point of contact. Depending on the region where you are, we'll have a team assigned to you so they can walk you through deep dive demos, any sort of, proof of concept if you need to see the technology working, and we can make this a pretty exciting, search for you.
Perfect. Thank you so much, Kapil and Matt, for your time today and for a great and informative presentation. I'd like to encourage everyone to visit today's sponsor to learn more about the services they provide to our industry. So please visit contact.io. As promised, the answer to today's trivia question is Georgia. So congratulations to our winner, Ron Perfetta. Just a quick reminder, you can obtain your certificate by completing the post-webinar survey, and the survey will be emailed 1 hour after the completion of today's webinar. You must complete the survey to receive your 1C credit from the ACI, and you'll be able to download the certificate directly from your computer once the survey is submitted. If you have any questions, you can reach us at webinar@mdpublishing.com. We'll be back next week with another webinar, so please visit webinarwednesday.live for more details and complimentary registration. Thank you once again for your time today, and I hope you enjoy the rest of your day.
Thank you, Linda. Thanks, everyone.
Thank you.